daughter who looks normal, healthy, and happy. But weekly she suffers from more than 300 seizures with grip her body for up to 30 minutes at a time. She screams in pain, she jerks in pain, but the seizures do not stop. Now imagine being a husband of a 30-year-old wife who's watching your wife suffer with stage 4 breast cancer. She lies in bed lifeless after her treatments, and there's nothing you can do to help her. But now imagine in both of these cases you're presented with one option of hope. And that hope is an unapproved drug by the Federal Drug Administration that may or may not be legal in your state. What do? You hang on to hope. Medical marijuana is a new drug, but it is unproven by the FDA. Yet its benefits are showing amazing strides in the medical field. I, like I'm sure many of you, have no idea what medical marijuana was, and for the next 5 minutes, I'm here to teach you about the hope it brings. I will educate you on the history, the overview, the patience, and the excitement this drug brings, and I will present you with the hope. The history of medical marijuana takes us back 10,000 years to Taiwan, where it was first used to treat pain. Moving forward a few thousand years, we see it used by the Chinese Emperor Sheng Hung, who was a pharmacologist who documented the benefits of medical marijuana in 2727 BC. Ancient India confirmed his findings and writings by saying that cannabis had strong psychoactive properties and could be used for a wide variety of medical treatments. But it wasn't until the late 1830s where Irish physician Brooke Williamson decided, when he was studying abroad, to take the risk to bring marijuana back to the West. He introduced medical marijuana to Western medicine. Cannabis entered the United States in 1850. As marijuana usage increased in the United States, the government decided to tax it. Using the Marijuana Tax Act of 1930, pharmacies saw a great decline in the use of marijuana. Cannabis was eventually removed by the U.S. pharmacy listing in 1940, and then altogether banned by the Controlled Substances Act of 1970. Fast forward now 10 years later, cannabis started to reattract patients through its pain relief with AIDS treatments, and cancer patients. California saw so much potential in this drug that it was the first state in 1996 to go against government and legalize medical marijuana. Now it's 2018. Not a lot has changed. Medical marijuana is still an unproven drug by the FDA, yet there are 29 states, plus Washington, D.C., that have gone against the government and legalized it for certain usage. They are lighting the blaze. Okay, let's keep going. Now, a quick overview of medical marijuana. The term medical marijuana comes from the unprocessed marijuana plant that is used to treat illnesses. The FDA has not approved its use or recognized it as a drug yet. The FDA requires hundreds upon hundreds of clinical testing and thousands of patients to determine the risk-benefits of a drug, and medical marijuana has not met that yet. Yet the FDA has approved one form of medical marijuana, which is in a pill form. This is used to treat nausea in patients with eating disorders. Medical marijuana can be used even though it is not approved by the FDA. If you are in a state with legalized medical marijuana, a doctor can write you a prescription to take it. One key advantage of medical marijuana is the many forms it can be consumed by patients. The 4 main ways it is consumed is by smoking it, eating it through an edible, taking it in pill form, or using it as an oil. The American Medical Association states that there is 2 main parts of the cannabis plant, the THC and the CBD, both of which can be controlled by scientists. This is a hard drug to study as it is classified as a Schedule I level drug, which means it is highly addictive to users. So if any drug company wants to invest in a study, they need to go through many rolls of red tape, including approval from the U.S. Drug Agency and other regulatory agencies, which is slowing down the process to legalize marijuana. Patients that are using this drug are from a wide variety of ages. There are literally millions of people who need medical marijuana. The heartfelt stories of what this drug has done to people are endless, and so are the stories of people crying out for this drug. Medical marijuana is legal in 29 states plus Washington, D.C., but why not all of them? Minnesota legislation from the Minnesota Statute Office states that it is legal in Minnesota if you are a legal resident, and also you can prescribe doctor's note for a certain case. These conditions, such as cancer, chronic pain, and also seizures in Minnesota, just to name a few. The most common use of medical marijuana is in pain relief with cancer patients, followed by people prone to seizures. It is also used for professional athletes suffering from brain injuries and veterans suffering from post-traumatic stress disorder from battle. Patients with Alzheimer's disease have also shown success with medical marijuana in slowing down cognitive loss. So with medical marijuana taking off right now, there's a lot of excitement for the future of medical marijuana. Even though medical marijuana is considered a mind-altering drug, there's a lot of proof showing it does not have long-lasting effects on the cognitive ability of adults. In the Health Harvard Education Journal, they talked about their investigation of medical marijuana, which seems to be the most up-to-date and promising. It showed that after 3 months of using medical marijuana, there was no sign in decline of cognitive function, and also the executive function of the brains, which is memory, motor control, and paying attention, actually increased while using marijuana. With the legalization of marijuana in several states taking off and the amazing amount of money being made, many marijuana distributors are contributing a percent of their profits back to medical marijuana research. Their hope is that they will use these profits to help people further and benefit from the plant. So in conclusion, medical marijuana is a drug that provides hope to many people. It provides hope to those who are suffering, and it provides hope to those who are watching loved ones suffer. Now, my wish today is you've learned something new about this drug, and if someday a friend or a family member is suffering, that you will one day find hope with medical marijuana. Thank you.